From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
You're listening to Veterinary Vertex, a podcast to the AVMA journals. In this episode, we chat about how parasternal thoracotomy via the sternocostal disarticulation can be performed in cats with good short-term outcomes with our guest, Kristen Gabriel.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today, we have Kristen joining us to talk about a novel surgical approach for our cat patients. Kristen, thank you so much for taking the time to be with us here today.
Yeah, thank you guys so much for having me. I'm excited to be here.
All right, well, let's dive right in. So, Kristen, your JABMA article discusses how a parasternal thoracotomy may be a suitable alternative to traditional approaches when thoracic exploration is indicated in cats. Please share with our listeners the background on this article.
Yeah, so the background kind of started with one of my resident mates, Anna, who actually was the first one to publish this technique in canine patients. And it's something that we had seen several surgeons at our hospital performing with, seemingly good outcomes and no major concerns. And then, we all kind of realized this isn't actually documented anywhere and published anywhere. And some of the surgeons that we worked with had, discussed how they'd seen other people do it and learned it from people. And we're like, this needs to be, written down so people can learn from it and decide, if and when it should be used as opposed to other approaches. And particularly in cats, we find that sometimes people have issues with median sternotomies, particularly with their sternums being so tiny and, accidentally getting off midline and sometimes even off of the sternum when trying to access the thorax that way. And so I thought, particularly in a group of cats where they're all kind of similar size and they all have, that same issue when you're sometimes trying to do other approaches, that this would be a really good thing to just document and get out there. And this is obviously a very preliminary study, just putting things out in the world and in the literature, but certainly kind of opens the door to do more in-depth comparisons and analysis of if and when this approach is useful.
Very cool. And since this is a technique, have you heard of our technical tutorial videos?
Yes, I have. And I've been thinking about, if we need to make a video demonstration, that would probably be very helpful.
Very cool. Yeah. Especially with cats. We don't have a lot of just cat videos in general or cat articles either for that matter. So
Yeah.
I'm looking for those. And what are some important take-home messages from this JABMA article?
I think the biggest take-home messages right now are, again, just kind of knowing that this technique is out there and that so far with our kind of preliminary data, it seems non-inferior to a lot of the other techniques that are out there. And that, even though there is kind of a high complication rate noted in the paper, that a lot of those complications are very minor and even really more incidental findings that we identified, and they don't really seem to have a significant, morbidity or mortality to our patients.
Kristen, I'm an equine orthopedic surgeon, so we do everything with a scope. Why not do an exploratory with now they have tiny needle scopes that have curved lenses too.
Yeah, and that's definitely something that people are doing. It's very equipment dependent. Now, even a lot of specialty hospitals, don't have all the equipment for thoracoscopy, and sometimes the one lung ventilation is very helpful for that, and not everyone is comfortable or has the equipment to do that successfully. The other big issue is with those minimally invasive procedures, you can't remove a large mediastinal mass or a large lung mass. You end up having to make a pretty big incision to get some of those things out of the thorax anyway. So it's certainly a useful technique for exploration, but not always, useful for removing or performing what we need to do.
Great. Plays right into the spectrum of care.
Yeah, absolutely.
What sparked your interest in feline surgery?
I've always been a cat person. And so as I've kind of progressed in my career as a doctor and then as a resident and everything, you start realizing, kind of like we alluded to earlier, there's just not as much information out there about cats. And we know there are some differences, obviously, between them and dogs and the way they heal and just some of their, musculature and their anatomy differs just in subtle ways. And so I think it's really nice to be able to have separate information on cats. A lot of times they just kind of get lumped together into some of the bigger studies that are majority dogs and then a couple cats, and you don't really know, how that plays into things.
Yeah, when I took over as editor, it was one of the most striking things to me is how popular cats are as patients and as veterinary patients,
Yeah.
but very, very little literature on them.
Yeah, I feel like it's newer, like, as we're advancing our technology and able to do more things, I feel like people are able and willing to do more for cats, whereas previously it was very, very dog heavy, just in veterinary care in general, in small animal at least.
What surprised you from this article?
I think for me personally, one of the surprises I had in kind of gathering all the data and putting it together was the amount of abnormalities that we did identify on radiographs. I had, like I said, previously seen some of these procedures being done and seen some of these post-op radiographs that we had. And I kind of expected the number of complications or abnormalities that we found to be lower, just again because of my clinical experience being that, these patients do really well. And so when our radiologist came back and said, almost half of these radiographs that you sent me have some sort of abnormality, I was kind of like, oh, that's not what I expected, but certainly not something I wanted to hide or try to cover up in the literature. It's out there and it's something we need to be aware of and keep an eye on to make sure that it is not a clinically significant problem going forward.
Kristen, I'm also a fellow cat lady. I have 2 cats that are currently laying in the sun, grooming themselves right now as we
Nice.
record this
Yeah.
episode. So what are the next steps for research in this topic?
I think the next steps kind of have to be two different directions. One, just longer term follow up. Again, making sure that some of those abnormalities we're seeing on X-rays are truly not causing issues down the line, and just getting a little bit more information on. It's so disease dependent with this type of surgery that obviously some of these patients they're not going to have a super long outcome because of their underlying disease, but just following them out and making sure that we don't see any surgery-related complications, as well as doing more of a prospective, direct comparison to, things like median sternotomy and saying, okay, well, let's compare things like patient comfort postoperatively. Let's compare surgical time, visualization that you're able to get during surgery. I think all of those things are important in order to help people make decisions going forward as far as, what approach is going to be best for their patients.
And AI is such a hot topic right now. It's everywhere. Do you see a role for AI in this area of research?
I think in any research, I think it can be helpful just as far as, extracting data from records and kind of speeding that process up for people. I also was thinking, like, I don't know how this would work. I don't know enough of the details of the technology, but I feel like there's probably a way to, if we're comparing things like visibility in surgery, to have, AI or some sort of technology calculate, based on a couple examples you give them of this is what we were able to see and here's our kind of landmarks in surgery. They can probably apply that to like a bunch of CT scans that, our patients you don't even necessarily have to have done surgery on. They could do a theoretical calculation of, with this approach, here's what you can easily see, here's what you can maybe reach surgically. And that way you get a lot more patients that didn't actually have to undergo surgery, and you can kind of start collecting some of that theoretical data.
Yeah, we don't even know how AI can help us yet in many ways.
Right. So many unknowns.
I love how you have a curious clinical mind. How did your training and previous work help you to write this article?
Yeah, I think for obviously this article specifically, it's something that, is just something I am seeing frequently in my hospital. And so it made for a good project because it sparked that interest of like, why is this something that's not documented anywhere else? Why are we doing this differently? What are the advantages? As far as actually writing the paper itself, that's actually something I hope to get more comfort with in the future and to continue to kind of grow in that aspect of my career going forward, because it definitely is challenging in some ways to balance clinical practice and doing all of that on top of research and publishing. And I found that as I progressed, from a student to an intern and then a resident, at first I was like, oh, I don't know what I would want to research. Like, there's, you don't know what questions to be asking. And then as you get a little bit more experience, you start seeing all these cases and seeing all these things that make you think of questions that you're like, oh, no one actually knows the answer to this question, or people just have anecdotal experience. So I think you start learning a lot more questions that you have, and sometimes it's hard to answer those questions, especially in medicine. Like, doing a really good, prospective study with enough patients for meaningful data is often really difficult. And so it's something that I hope to keep trying to contribute to in my career.
Yeah, my words of wisdom would be to find somebody to help with study design so that
Yeah.
you don't get all the way down and you're gathering the wrong data, or it's not randomized correctly, or any of those things.
Right.
It's heartbreaking for our editorial staff to get a review back on a manuscript that's like, you can't fix it,
Right.
right? And it's all the time.
Yeah.
So, Kristen's next set of questions is going to be really important for our listeners. And the first one's going to revolve around the veterinarian's perspective. So, Kristen, what is one piece of information the veterinarian should know about parasternal thoracotomy via sternocostal disarticulation in cats?
Yeah, I think for other veterinarians, just again, knowing that it's an option and knowing that even if you're not choosing to perform this approach right away, like I said before, if you are doing median sternotomies and you find that you've slipped off of the sternum at one point, like, this is, I think, a very helpful article to have, just to say, that's okay, here's how you can close it still, and they're gonna do well. And just having that kind of reassurance and that backup plan when things maybe don't go quite as planned for them. I think it's also a good option for, if you don't have some of that equipment available, like we talked about spectrum of care earlier. Like, sometimes, you might not be able to be referred somewhere else for certain procedures, and this is sometimes an alternative that could be done with different equipment.
Now, on the other side of the relationship, what's one thing that clients should consider when their veterinarian is proposing this surgical option to them?
Yeah, I think from a client perspective, especially, in this day and age where people can just like Google things really quick and see some of these articles pop up, just knowing that, again, that like 50% complication rate does not necessarily mean, this is terrible and 50% of them are going to not do well. That's to just not be scared by that, and to dig a little bit deeper and see that, a lot of these are minor complications, and really more so just a means for us to document all of these things that we're seeing.
Oh, fantastic. What a great article.
Well,
As we come to a close, we ask a little more of a fun question. I think I can probably predict this, but we'll see. When you complete a puzzle, Kristen, do you do the inside or the border, or do you do like a mosaic part of it, like part of the scenery? How do you go about attacking a puzzle?
I am definitely a border person, and
Yeah.
growing up, I thought that was the universal answer. And I remember the first time I saw some of my friends doing a puzzle in kind of that more mosaic fashion, and I was like, where are the edges? What are you doing here?
Sarah and I have a hypothesis that those that are surgically oriented do the borders, and the
Oh,
more medicine sort of folks do interior. So we have to look back at our data to see if our hypothesis holds.
I could see that being true.
Yeah, spoken like a true surgeon. As soon as Elise asked that question, I was like, we know what you're going to say.
That's so funny.
I think before we had one person who was like, maybe like a surgeon, or they said like middle, but they said they wanted to be an internist at first or something. So there's
Yeah,
hybrids
that
out.
makes sense.
But thank you so much, Kristen. We appreciate you being here with us today, and also for submitting your manuscript too to JAPMA.
Yeah, absolutely. Thank you guys again so much for having me.
And to our listeners, you can read Kristen's article in JAVMA. I'm Sarah Wright, Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.